have some more excitement to finish the day. I would like to give the floor to Professor Guglielmo Trovato, who is also the Director of Communication of the European Medical Association and
Everything.
Yes, exactly. Executive.
The artist.
The artist.
Also, everything.
Yes.
The point is that not only Gabriele, also Arianna, and you too, and most of you, said what I would like to say. According to my previous experience and work, Gabriele, thank you for focusing on semiotics. We call still semiotic, that means physical diagnosis. I remember quite less than 60 years ago, I learned physical diagnosis, also neurological diagnosis, and also microinvasive diagnostic neurology, that is spinal tech. We made personally. And thereafter, we made a lot of things. But the main job was to teach medicine to medical doctor, to young students and medical doctor. All the diagnostic, physical diagnostics. And our line of school is a school of emergency medical doctors and specialty also, mainly cardiologists. My main specialty is cardiology. And I went here at Brompton Hospital exactly 50 years ago. 50 years.
50. Okay.
For learning echocardiography, and from then I was before in New York at Mount Sinai Hospital for learning echocardiography. And from then we developed a school of clinical ultrasound in our School of Medicine. Clinical ultrasound is the twin way with physical diagnosis for spare environmental waste with useless NMR, useless scans, and so on. And it is very regretfully that here in UK, clinical ultrasound can be made, apart obstetrics, can be made only by radiologists. Because a lot of information can come from clinical ultrasound in, of course, cardiology, but liver, joints, and even brain circulation. So it is very important, this skill in the hands of medical doctors. We did something inside the European Medical Association for endorse this line of work and of teaching worldwide. My presentation is not so interesting because the most important things were already said. So I will focus mainly on something that may be lacking. That is, for instance, Joachim Bolsevio said something about the future that is in the talk of our commissioner. There is something about the new global health resilience initiatives. This was said and written a few days ago, talking about health initiatives mainly against It's not good to do something against, but mainly against the United States initiatives in the topic of Earth. It's very clear this. So European pride and also UK pride that is greater in this issue against the waste of health systems, not only public health systems, not only, but good medicine, I would say, good medicine. Today is very more older than me. The president of the European Medical Association said, in our mission, in our, si dice statuto, statute, yes, there is written, our mission is the care of patients and the care of the environment where they live, home, together. This is in our statute 40 years ago. And this is the reason I am here, the only reason, no other reason. Cutting on something you can read, I can read, but it is useless concept. The drawings are made by our students. This is the point I promised you. Some of the current initiatives of the European Commission dealing with environment and health. We provided contributions and suggestions. So it is not a theoretical presentation. I am saying what we did, not with results, because our initiatives ongoing or just beginning. This is Europe. And usually, also in Europe, we try to follow the suggestions of WHO, is correct? Which is often constrained by the attitude of the more timid governments of the countries it aims to serve. And so the suggestions of the directives are not directives, were resulting in processes almost entirely incapable of impacting policies, particularly energy and industrial policies in a preventive sense. Both sentences come from my best consultant, that is Giovanni. Oh. We use the tool, have your say, in the European Commission, also other tools. The tool, have your say, is a way for speaking directly with the Commission, providing comments on the initiatives. We do what we can with our knowledge, our expertise, our sensitivity. What we said means essentially that we had the need for educational and training components in university curricula with practical experience. And we asked that the contribution of non-governative organizations will be always highlighted and valorized. Valued. This aspect in the presentation of the new initiatives of the European Commission are not considered enough or not considered at all. Also, for this comment, I need something that say, yes, it is true. I asked the help and the contribution of our consultants, including Giovanni, that contributed also these concepts. What I'm saying, how we are working in this field together, contributing to the work, to the directions of the European Commission. This is not my former, also current, work of research, clinical research, or teaching. This is another thing. It's a way of trying to influence the opinions of politicians and also the opinions of who can read what we suggest, because these suggestions are public. Now we are alone here, experts, medical doctors, economists. Where is Anna?
Yeah.
Okay. But this program changed because we would tried to have with us, and they said yes in advance to Parliament member, to European Parliament member, and in particular Ignazio Marino, that is a heart surgeon, a liver surgeon, and made the first liver transplantation from baboon to humans in the United States 30 years ago, 20 years ago, and founded in Italy an institution making many liver transplantation. He was also the mayor of Rome in recent years, for several years. The second person that accepted to come here, but today there is the Assembly of the European Parliament, so it was not possible for them to come. The second person was Leoluca Orlando. Is a name for somebody or for nobody. Leoluca Orlando was for several years, 12 years, the mayor of Palermo. It means one of the leaders of the fight against mafia in Italy, in Sicily, and worldwide. Two persons, what is the link with the environment? Both are green, in the green group of the European Parliament, and both are linking the green policies with humanitarian actions. So it is not by chance, not because they are personal friend of somebody. It's not the reason. The reason because they were both really interested in the small things we can do together and we can say. Small things. It's a small meeting, a small workshop. Okay, titles. This is mine. The legislative context, this is completing something. Influence the real world adoption and long-term sustainability and of behaviors related to environmental act. It provides framework for change. It must be combined with psychological interventions to be effective. And this is the point. Which are psychological interventions? What is health psychology? It's a real expertise because it can enhance sustainability by making change easier and fairer through education, framing, support, addressing the individual, community, and policy level factors. Models like theories of changes, so used in the international context, and behavioral economics, Anna, explain how legislative structures combines with one set psychological approaches tailored to specific contexts are essential for fostering environmental stewardship. No quote, no reference, because this is mine. I read and this is mine. Information is not enough. Simply providing information on environmental and climate changes does not automatically leads to desired actions. The public desires clear leadership and a coordinated government approach to make green behavior easier and fairer, underscoring the need for supportive policies. Maybe somebody remember this tale, La Fontaine fable of Coachman's fly. It is a fable about a fly that tries to take credit for solving a problem it contributed nothing to. That is, the coaching fly is on the fly, on the horse, on the mule, and said, okay, he's going where I wish that he must go. What are professional medical associations? Worldwide, but in Europe, are almost national and serve quasi-union purposes for the profession. Everywhere, also here, the Royal College of Physicians, of which I am a fellow, is a way of being present in the world, but not in the world of in London, not in the world, but nothing more. And also, its president and the former president don't do any action on in the sense of clinical change. They work for medical doctors, for stipendi, and so on. We aim to support the quality of physicians' clinical and research activities and to provide patients with information and care appropriate to current times. The other concept of the association is better informed doctors make better care patients. It was written 40 years ago. We are fully aware of the possible futility of our contributions, criticisms, and suggestions, because they remain often without tangible outcomes. But we are not deterred from continuing this path of actions, of study, discussion, and information. Even not having, in this case, any role inside the European Commission. We have credit. Sometimes we are called gratis for kudos. But Europe is not anymore so much England, but it does matter. It is the same. These are the titles of the contribution we made to the initiatives of the European Commission. Toward the circular, regenerative, and competitive bioeconomy. Cities, new policy agenda. This is particularly interesting. A cultural compass for Europe, again for the cities. And other contribution, I asked also the help of Giovanni, regarding the European Center for Disease Prevention and Control evaluation, and mainly strategy to support medical countermeasures against public health threats. We wrote what we were able, what we could. Crisis preparedness for stockpiling strategy. Long-term budget for cross-border education, training, and solidarity. Rules on geospatial environmental data and access to environmental information for all Europe. I understand that all these are only titles, but are the title of a document, of an initiative, of a legislative initiative. We commented and we provided the suggestion with other persons and other public on this. How can we disseminate? Any comment on these initiatives is disseminated on our social media, which means that ideally can reach 1 million followers. It is almost nothing because followers does not mean that it will be read. But how many read your best article? Mm-hmm. So we have also the goal, already published some of them, of publish a position paper of the European Medical Association. And the leader of this position paper is again Giovanni. I cannot be the leader, of course. We published another position paper. One of the, can remember, is of 15 years ago on, we can call precision medicine. We call it predictive, preventive, and personalized medicine in that position paper. A point is that several European universities are already offering environmental health curricula for medical and health science students, covering topics like climate change, air and water pollution, antimicrobial resistance, social inequalities, and toxicants within a global and planetary health framework. One of these is the University of Milan, but certainly there are other. So my suggestion was to be in touch with them. It's not a small group, it's a group of 10, 11 professors, full professors, associate professors, research fellow. So not really small, but I don't know what they really study, research and publish, but they exist. This is a comment of the work that Giovanni and Camilla and you, I knew today, did already. He published his experience with 2 articles on frontiers in public health, correct? Yes. Yes. As you see, I have only one gift, the memory. Only the memory. And this is